The views, opinions, and content of this show are those of the host, guests, and callers. They do not necessarily reflect those of Local Matters Broadcasting, LLC, its owners, partners, affiliates, assigns, or heirs. Having said that, it's now time to say good morning, St. Johns County. Welcome to the weekly radio show of the St. Johns County Council on Aging, better known in our community as the COA. We are your local nonprofit agency who for the past 51 years has been leading and advocating for the dignity and independence of seniors and responding to their changing needs. I'm Brian Robinson, Program Director for COA, broadcasting to you live from the studio, WFOY 102.1 FM, your local radio station for news, sports, and talk. Before we get into our show, let me remind each of you that if you have a question, comment, or a suggestion, or if you want to compliment me on my ability to drink coffee while navigating my car through all the construction projects in St. Johns County, you can send that email to radio@coasjc.org. Again, that's radio@coasjc.org. And if you have a question for our guest today during the show, you can send an email. I have it up in front of me, and I will be checking that throughout the show. We'll try to work your question in. So again, that's radio@coasjc.org. Joining me this morning is Paige Stanton, Executive Director of UF Health St. John's Care Connect. Good morning, Paige.
Good morning, Brian. Thank you so much for having me.
Very good to have you in the studio. I was glad to have you here last year.
Yes.
And last year I had you and our wonderful Tina Brofield in the studio.
Yes.
And it was nice to have the two of you in the studio together. But today it is just yourself. And the fact is there might be some people listening that did not hear you last year. And maybe they don't know anything about you. So I was wondering if you would just tell our listeners a little bit about yourself.
Sure.
And then also provide an overview of Care Connect.
Oh, great. Well, thanks so much, Brian. Happy to share about what we do at Care Connect. And just want to echo your sentiments before we get started. I would be more than happy to answer questions. So if people have questions, please send those in. Want to get all the information that we can out there about Care Connect and the Community Health Improvement Department of UF Health St. John's. So I will give an overview, and I'll try not to ramble on too long so we can get to some other questions. But what we do at Care Connect, first and foremost, is connect individuals who are needing resources in the community to those resources. We try to make that navigation process very easy, convenient, and also make sure that we're building out a network of providers and resources in the community that fill the gaps that we're seeing. In short, every 3 years, we're a nonprofit hospital, UF Health St. John's, and so every 3 years we have to do what's called a community health needs assessment. And that is really looking at St. Johns County as a whole and understanding what are we doing well, what services do we provide well, and what are the major gaps in our community. And that drives all of the work that we do within the Community Health Improvement Department at Care Connect and our various programs that we deploy into the community. So really, you'll notice a theme as we kind of talk, Brian, about some of those main things that come up time after time in each community health needs assessment. There are certain resources and gaps that have rang true for several years that we've been working to fill. And so I'll kind of go over those, but it's going to be access to food and healthy food, access to care, so whether that's primary care, urgent care, that's going to be one of the gaps that we see, access to mental health services, and homelessness and housing. So those are big issues, right, that we've been trying to tackle through the community and with the community hand in hand in collaboration. So really that's our focus, and that's the why we do what we do at Care Connect. We have several different programs, and we'll talk more in depth about those that we have at UF Health St. John's Care Connect that kind of touch on each of those areas. But overall, like I said, we've got individuals in our office that are first and foremost navigating resources every single day. We've got a team, a fabulous team of what we call community health associates, and they are the individuals that are taking the calls, reaching out, taking the walk-ins to our office to help individuals that may have a need. And that doesn't have to be just anything in one of those four areas. It could be, I need transportation to my job. My car broke down and I'm struggling. I need to figure that out. So we're there really to act as a problem solvers and to make sure that we connect you to the appropriate resource. There's nothing more frustrating than when maybe you've reached out for help in the past before, and you're knocking on a door and maybe you weren't eligible for that service, or you didn't quite fit the bill for what that program has to offer. So really our job is to link you and to make sure that there is no barrier in between you and the service that's provided. And we want to see that, need be able to be fully met for the individual. So we've got individuals doing that every single day. And then we also have, if anybody's seen the big blue bus on wheels rolling around the community, the Mobile Outreach Clinic, we've had for several years. That has undergone, quite a program expansion. We're very excited that we're able to offer those services. But really, that's all about access to care for those individuals that wouldn't otherwise have access, whether it's a lack of insurance, whether it's a lack of transportation. We're going into communities that wouldn't otherwise have that access to care. And so Mobile Outreach Clinic has a coordinator, a nurse, and a nurse practitioner, and they are doing fantastic work out in the community. We have the BRAVE program, which is our youth behavioral health program. I think we're going to talk about that a little bit more. And then we lead the continuum of care for St. Johns County. So UF Health St. Johns is the lead agency, and the continuum of care is all around tackling housing and homelessness issues in St. Johns County. Hopefully that's an overview there, and we can kind of break it down,
that's
Brian.
Fantastic. Well, and again, lots of different questions that we'll ask as we continue on with the show. But as you're describing all of this and what you do, and I'm thinking, okay, is this unique to UF Health Flagler Hospital? I mean, because I'm not an expert on hospitals,
Sure.
right? So is it unique, or is this something that happens across the state of Florida or even across the nation?
Right. Great question, Brian. So I will say unique by way of, Flagler Hospital, of course, has a long-standing history in St. Johns County and has been here as a provider and a critical provider to our community for many, 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 many years. And so I will say that extra layer of just caring for the community that UF Health St. Johns, formerly Flagler Hospital, has provided has been a consistent theme of going sort of above and beyond for many years. And so I would say there's a unique aspect there. And also, being that a sole community hospital for so long, a lot of people look to the large health system in town to provide not only for their physical health, but for their social health as well. And so that's really where we started evolving and taking, the driver's seat with the Community Health Needs Assessment and Care Connect and evolving these programs. Certainly there are other arms. UF Health is a nonprofit organization, and so there are other hospitals up in Jackson, Gainesville, and they have some fantastic community services as well. But I would say the programs that we provide here are unique and tailored to our community and the needs that we're seeing. So, I don't know that there's any other community hospital doing it quite like how we are doing that, but that's because we try to be very intentional about building the programs and searching for funding that is going to fill the need within St. Johns County.
Well, I think it's a phenomenal program and phenomenal what you do, and we're going to talk more about it. We're going to go ahead and take our first commercial break. You're listening to the weekly radio show of the St. Johns County Council on Aging, and we'll be right back after these messages. And welcome back to the weekly radio show of the St. Johns County Council on Aging here on WFOY 102.1 FM, your local radio station for news, sports, and talk. I'm Brian Robinson, Program Director for COA, joined in the studio this morning by Paige Stanton, who is the Executive Director of UF Health St. John's Care Connect. Very long title there for you.
It is. It is,
Well, we just refer to it as Care Connect.
That's right.
Yes, and during the first segment, you gave us a great overview of Care Connect. Mm-hmm. And so my next question would be this. Who is eligible to receive the services provided by Care Connect?
Yeah, great question. So, of course, first and foremost, anyone residing in St. Johns County who needs assistance navigating resources, you are more than welcome to go online to our website, Care Connect. It's still careconnectplus.com, but it will bring you to UF Health St. John's Care Connect. There is a button that says Get Connected. You'll click on that. And some exciting news, we've recently shortened our form for getting connected. We found that the longer form was just creating some unnecessary barriers and had gotten some feedback on that. So we've really shortened it to just getting your name, contact information, the basics, so we can get back to individuals very quickly. So would encourage you to go on there. Anyone that's needing support with any resource, please go on there, fill that out. One of our community health associates will be in contact within 48 hours, as well as you are also welcome to walk in if you're unable to send in the form or give us a call. We do accept walk-ins. We are at 100 Whetstone Place, Suite 303. It's the building right in front of the hospital here, and so we would be more than happy to help start navigating the process. So anybody needing support in that way in St. Johns County certainly is eligible. And then with some of our other programs, specifically with BRAVE, that program goes outside of St. Johns County. We work with several districts throughout the state of Florida, and so the students and families that are in those districts that we participate in are also eligible for services.
Yeah, and we'll be talking more about the BRAVE program a little bit later in the show. Looking forward to talking about that. So let's then talk about the step-by-step process that someone can expect to experience, right? So you said there's the option to go online, but they could also walk in. I assume they could call as well.
Yes, absolutely.
So a few different options to get connected, but then what happens?
Yes. So once you get connected, and our phone number, I don't think I mentioned, it's 904-819-3070. I'll say that again at the end, just as a reminder for those that would like to get connected. But no matter if you go online, if you call, if you walk in, once we're able to collect your information and connect with you, we will then start an assessment. So we're going to ask questions, get to know you, understand your situation and what it is that you're looking for. We have, like I said, community health associates. So we've got some really incredible individuals who are highly versed in navigating the resources within St. Johns County, very compassionate individuals that are happy to sit alongside or talk to individuals needing that support and sort of looking at what that unique journey might be for them. And so they will do an assessment. And then they will start, learning about what it is that you are looking for and then assessing those resources. And so we leverage technology. And, of course, we have over 130 partnerships throughout the state of Florida with various resources to be able to screen you for what you may be eligible for. So, again, taking away that barrier and frustration of maybe not understanding a program or not knowing where to go, not knowing what you're eligible for. We really want to be there to help you walk through that. And then once we're able to refer you to a community agency, we want to make sure that we're able to also close that loop. So we're going to stay in contact and make sure there aren't any issues with, applications, if it's Medicaid, SNAP application, if it's housing, if it's food. We want to make sure that you are actually able to fill that need. And so there could be several components, right, in doing that. If it's transportation, you're unable to get to a food pantry, we have a partnership with Uber Health. We can help you get transportation. So those are just some examples of things that we could provide for individuals in the community, but we're going to see that need all the way through, make sure that we're able to fulfill that, and then close that case out once we're able to be, successful with that individual. So we're really going to walk through every step of the process.
Yeah, another thing that you do that I think is wonderful is called the Resource Collective, and that meets the last Friday of every month. And that's just really a hodgepodge of organizations that provide different services to people of all ages that come together. And there's usually a guest speaker that's kind of presenting on, what they do.
Yes.
And then everybody kind of takes turn, goes around the room and kind of says, hey, this is what, here's somebody that has a need. And then usually, now I've only been to a few different meetings, but usually somebody else will say, oh, well, we can help with that.
Exactly.
And so it's just a great thing that you do. Can you talk a little bit more about that for just a couple minutes as far as anybody out there listening that might be an organization that serves people, how they could be a part of that?
Right. So, and part of Care Connect, which is, thank you for bringing that up, Brian, is helping the individual, but Care Connect was also built on this concept of connected resources, right? Because it can often feel siloed or disjointed. We know, and it's very common in the nonprofit or social services industry. Funding comes, funding goes. New programs come, new programs go, and that's the nature of it, which is there's certainly a pro to that. However, it can be difficult to navigate for individuals. So it's not just the individual aspect. It's really Care Connect was there to be a platform to connect agencies as well, bring them into what we call the Care Connect Information Network, so that we are able to then add them in and determine if it's a resource, that would be a good fit for someone. Part of that is the Resource Collective. And that was really grown, again, from this idea that we need a space to network as agencies when there's a new program coming in or a new agency that stood up in St. Johns County, really being able to connect with the right individuals, share what they're doing in the community, and then stay connected on a regular basis. That's really important because of what I had just mentioned, the changing of funds and programs and things of that nature. And at the end, I've never seen it, work so well. And I will give kudos to Jennifer Wills, who recently retired from our organization. This was her sort of brainchild, and the idea to raise your hand, what is it that you're needing as an agency, and connecting that individual with another agency that might say, oh, I actually have a program that could help perfectly. And we've seen some pretty incredible collaborations come out of just those communications that are happening in that room. Usually a great turnout, anywhere from 50 to 70 individuals in that room, having very open conversation, being collaborative. And so that's really, sort of the other piece that Care Connect is there for, is to bring together services and agencies in the community to build more programming opportunities, not to duplicate services, but to leverage what we have between all of us here in St. Johns County to build something better.
Yeah, and, a great example is Pie in the Sky. And, they come to that meeting, and I was at the last one with them. And, and they help meet the need of seniors that we're not able to meet, right?
Yes.
Because we only have so much funding to provide Meals on Wheels. We have hundreds of people on the wait list. But it's so nice to be able to refer them to Pie in the Sky.
Yes.
And then they can help them, right? And so I just love the fact that you do it, that the Resource Collective allows organizations to come together and then allows them to collaborate and partner together to serve the people of St. Johns County. That's what it's all about.
Exactly.
And so if somebody's out there listening, you work for an organization and you serve people and you want to be a part of this, it's the last Friday of every month. There's a couple months that it doesn't meet.
Yes, it's March and November. March is our Brave Summit, so there's a lot going on in that month. And then November is close to the holidays, usually, Thanksgiving and all that. So we try to give folks a little bit of a break. But we meet every month. Otherwise, like Brian said, last Friday of every month, that's going to be 9 to 11. Sometimes we end a little bit early. Sometimes we go on, just depending on. But that's going to be at the Health and Human Services building in the Kingfisher conference room. That's on the first floor. Any organization new, been in the community many years is welcome. It is an open invitation.
Yeah, and you don't have to RSVP or anything. You just show up.
Absolutely.
All right. Well, we have about a minute and a half before our next commercial comes on. If you would start talking, and we can continue on after the commercial break about the mobile outreach clinic.
Yes.
Yeah. Tell us about that.
So I'll give a quick, and then we could come back to it.
Yes.
But like I mentioned, it's a big blue and orange bus that you've seen maybe rolling around town. But that is our mechanism to get out into communities that would not otherwise have access to services, or to go to communities that haven't been asking for a specific service that have not been able to obtain that. So we've got some great examples. We do some clinics, blood pressure monitoring clinics with the COA, and those are really popular. Being able to go into the community, provide those services, where those individuals or seniors are residing, and be able to offer that up in an easy way. We're doing that with some other clinics that I'm happy to share about as well. But that is really how we're providing access to care to St. Johns County. And I'd love to share more after the break about how we're looking at expanding that programming. We've been really working hard to build our strategic plan out for this coming year to really meet the needs of St. Johns County.
Yeah, and you have just the one bus, right?
Yes,
and
just
so
one.
It's covering pretty much the whole county.
Yes.
So it's kind of limited as far as who it can serve. But I absolutely love that. I love the fact that that UF Health Flagler Hospital thinks about the whole county, right? It's not just focused on St. Augustine where it's located. It's really the whole county. And I know that you have other locations. You have a location in Nocatee. I believe also Durbin Park. Is there another location?
Yes, Durbin. Our second hospital is being built.
Built, yes. So you're branching out. All right, that music means it's time for our break. We'll continue our conversation right after these messages. And welcome back to the weekly radio show, the St. Johns County Council on Aging, here on WFOY 102.1 FM. your local radio station for news, sports, and talk. I'm Brian Robinson, Program Director for COA, joined in the studio this morning by Paige Stanton, Executive Director of UF Health St. John's Care Connect, which we just refer to as Care Connect, so we don't have to say that every time we mention it. Before we went to the break, we were talking about the Mobile Outreach Clinic,
Yes.
also known as the blue-orange bus that
Yes.
people see around. We talked about the different places that it goes. Who qualifies for that?
Yeah, great question. So currently, right now, we're providing a lot of education, like I had mentioned, blood pressure clinics. We have some blood pressure cuffs to give away for individuals that are needing that and wanting to monitor on a regular basis. So really exciting. We were able to get a grant for some of those. Individuals who qualify, right now with education, we're serving anyone who's interested in learning. So it doesn't matter if you have insurance, doesn't matter if you don't have insurance, if you are interested in some of the educational series we're putting on in Hastings or up with COA, you are more than welcome to come and learn. We would love to have a large group of individuals. Like I had mentioned, we are really working on expanding clinics. Right now, we partner heavily with Wildflower Clinic. They're fantastic. They're the free and charitable clinic in St. Johns County, providing care for uninsured individuals. We partner with them. We work with their doctors to also provide medical clinics around. So if you're familiar with like Dining with Dignity, that happens downtown once a month. We're going downtown providing care for uninsured individuals who may be needing that there at Dining with Dignity. There's some other places that we go. If you're interested in learning about where the bus is going, you can also go again to careconnectplus.com. There is a drop down in programs called Mobile Outreach Clinic, and we have our entire calendar for the month. Because we change and rotate it regularly, we have different programs and clinics popping up. The best way to learn about where we're going to be is to go to that calendar and track that. Excited to say, though, we recently employed a nurse practitioner. Her name is Susie Spell. She is fantastic and has much experience in the community, as well as our nurse, Fifi. And we are currently working on getting our own clinics as UF Health St. John's set up to provide access to care. That will be for individuals who are uninsured in the community. So we will start going out into Hastings more frequently, West Augustine, up north some, to provide some of those clinics. And so we'll be doing a number of things. Could be wound care, could be, if you're having trouble getting access to your medications, we can get you connected. We can't provide medication off of the bus, but certainly we have an opportunity to connect you to a provider who can get you that medication. So we're really working hard to expand that service and hoping to be able to get some of that up and running. We're just finishing on the build out of our electronic health record. We switched recently in the hospital to a new one, so we're getting that finished up here within the next week or so.
Yeah, navigating the joy of learning a new system, right?
Oh, yes. Lots. With transition comes about 25 new systems. So we are navigating those and moving forward full steam ahead.
Yeah, great. Well, that's a fantastic program that you offer. I just love that you do that. One of the other programs that I absolutely admire you for doing is your BRAVE program. Mm-hmm. BRAVE stands for Be Resilient and Voice Emotions, and it is designed to reduce stigma and create conversations around mental health with youth. So if you would take some time to educate our listeners about this program, including its impact on teens, not only here in St. Johns County, but throughout Florida.
Yeah, absolutely. So the BRAVE program really started back in 2018, 2019, in conversations with the St. Johns County School District, realizing that, it was no surprise. We knew that the data statewide and nationwide was showing that there is a rising and increasing need for mental health services across the board, and at an exponential rate for teens. It was rising, that need. And so really we got together with the district and decided we can deploy our Care Connect model, connecting individuals to resources in a mental health capacity. Let's try that out and see if that's something that works. Lo and behold, we were able to take the rate of individuals who were getting connected to services before implementing BRAVE in the schools from 35%. When we finished the first year with BRAVE working with St. Johns County, it was at 90%. So really, we were able to be very successful in connecting individuals, not just referring out. So if you are a student or a family in need of mental health services, we're going to take that, assess you for what's your insurance, what it is that you're needing, what have you experienced before? Have you had an experience with a mental health provider? All of those components that play a factor, connect you with a mental health provider, and we're going to make sure that you have several visits before we go ahead and say that you've been successfully connected. So we're making sure that it's not just a referral. We're connecting you and making sure that it's a good fit for you and your family so that you can be successful and meet those needs. So that was very successful. Since then, we've expanded year after year into several more counties. We found that this was a highly successful model, so we looked at, can we deploy this in Nassau and Clay County? Will it be as successful? We found that it was, again, on average, 90%, just as successful as it was. So we started to ask the state for some funds because this is a model that we think could, fill the need across the state of Florida. We were successful in receiving those funds, and so we've been on a journey since then to make this a statewide model that can be deployed in every school district in the state of Florida. So with that being said, today we are proud to say we're in 10 counties throughout the state of Florida, connecting families to resources. We just this past year hit over 5,000 referrals successfully connected to services. So that was really big, very exciting for us. And we're touching just over, I want to say, 300,000 students and families right now. And so, of course, you think students, and we're also navigating mental health services for the household as well. So 300,000 times, other individuals that are in that household. It's just incredible. We've had such a great team that's been so passionate about connecting individuals to these services, being the expert, making sure that we're sort of being relentless and, we're going to get you to the right place regardless of whatever that barrier is, insurance, funding. We're going to break all of those down to make sure that you get what you need. And so we've been able to be very successful and excited to continue to expand that program. We've got a couple of counties on deck this coming school year.
And then each year you do a summit, which
Yes.
is usually at the amphitheater. And students are bussed in from all across the state to come to that. It's not just students from here. I have not been to one, but I've kind of seen some of the news articles and stuff. And it's basically just letting them know it's okay to not be okay with your mental health and to tell somebody about it and to get the help that you need. And I think that is huge because I think for myself, I've my entire life, from the time I was a teen till now, I've battled with depression. But I think back to my teen years when I first started, battling with depression, and the stigma was so great then, that I did not say anything. So I suffered silently. In fact, I suffered silently for a number of years before I finally got help. So I think it's fantastic that you have this program that is saying to our teens, to our youth, hey, it is okay to not be okay and to seek help. Yeah,
the summit is really special, and it's sort of a cornerstone event, and we'll come back to that.
Yeah, we'll continue that conversation right after these messages. And welcome back to the final segment of the weekly radio show, the St. Johns County Council on Aging, here on WFOY 102.1 FM, your local radio station for news, sports, and talk. I'm Brian Robinson, Program Director for COA, joined this morning by Paige Stanton, who is the Executive Director of UF Health St. John's Care Connect. Prior to the commercial, you were describing what goes on at the Brave Summit, so I would like you to just continue talking about that.
Sure, happy to. Really the Brave Summit was the cornerstone in realizing that as we're connecting students to resources, they were also asking for a space where they could come, learn, talk, be open, without sort of fear of maybe judgment, and just have a safe space for them to come and learn about mental health resources. So that's why we stood the summit up in the first place. And that started with 50 high school students on a Zoom on a Saturday during COVID. That was the very first summit. And it's grown since then. We've had it at the St. Augustine Amphitheater each year thereafter. They're a fantastic partner. And this past year, we had, all in all, when it was said and done, students, vendors, volunteers, 2,400 people in the amphitheater. So from 50 to 2,400 is pretty stark, and it's grown rapidly each year. And we just see every year the students coming back and saying, I went before, I learned so much. I deployed that with my friends, my family. I took away resources. I got connected to the help that I need. I met somebody who I wouldn't have otherwise met at the summit. So just making those critical connections and making sure it's filled in a space of it's okay to have hard conversations in a positive way. So really we say it's fostering mental wellness. We're having hard conversations, but that there is a way through those hard conversations, and we can help navigate those resources. So just a powerful event. Would encourage anyone with a high school student this coming year, send them. Doesn't matter if you're from St. Johns County or not. If you can get here, we send a bus your way. send your high school student free of charge, 100%. We do not charge for it. Food, resources, giveaways, it is all free. So we're happy to provide that for the teens of Florida.
Yeah, that's fantastic. Well, I love that you do that, and I wish you more and more success as you continue to do that to reach the youth of not only St. Johns County, but throughout Florida. All right, I want to move on to another topic here, and that is prescription drug assistance. So COA has a prescription drug assistance program. Annually, we help about 300 seniors save over $3 million on their prescription drugs. And according to your website, Care Connect also assists people in navigating programs that are available to help obtain prescriptions. So would you talk a little bit about that?
Yeah, absolutely. And what a fantastic collaboration it's been throughout the years. Brian, we were just talking about Tina Brofil. She's not here today, but she is the first person who taught me all about prescription assistance when I first moved to St. Johns County, so I'm forever grateful for her. And we've been able to support the COA with that program ever since then, and it's incredible, $3 million. I mean, that speaks volumes, speaks for itself, right? So what we're able to do at Care Connect, because of that collaboration, we can send our seniors over to COA for Tina to work with. And those individuals that don't qualify for COA's program, we can also help with prescription assistance. We also partner with the county. They get some funding for prescription assistance. So those who are in the hospital, maybe uninsured, underinsured, same with individuals that come to Care Connect saying they can't afford their medication, we can connect them and pay temporarily for some of these medications. We can't do any narcotics, that kind of thing. However, if you need like an Eliquis or a critical medication, we can connect you to that, temporarily help pay until we get you set up with a prescription assistance program to bridge that gap so that you're not coming off of your medication.
Mm-hmm. That's a great program, and shout out to Tina Brofil. That works for us. She's amazing at what she does, and we're just so grateful for her. So we have, a few minutes left on our show here. I was wondering if you would look towards the future.
Yes.
So what new programs or services are you hoping to get started at Care Connect?
Yeah, it's a great question. I have fantastical ideas, Brian. So it's ever evolving. But I think, continued expansion of the BRAVE program, our goal is 67 counties. There are 67 counties in Florida. That means there are 67 counties we need to be in with the BRAVE program. I feel strongly about that. It works, and it works for a reason. We're happy to provide that to the school districts. We love to partner with the behavioral health agencies and the school districts. So that's, really where we're headed towards is 67 counties, across. Like I had mentioned with the mobile outreach clinic, we have a lot of planning, and I think things we'll see come to fruition this year, which is really exciting. A lot more clinics provided by our nurse and nurse practitioner. And so keep an eye out for those. Looking to get more and more access to care to those who do not currently have access to care. We've got some, I don't want to give away too many of my ideas, but some ideas around the BRAVE program to add some more things for students to be involved. We are hearing, more and more that student voice is a critical piece. And so keep an eye or ear out for some of those things coming your way. But I think, just continuing to serve individuals in St. Johns County, we're looking very closely now at how the services we're providing, of course, are provided partially by the hospital, how that connection plays and what that savings is that we're able to assist the hospital with. So, for example, the mobile outreach clinic, I think we've already saved over $300,000 for individuals that we've served just this year because they would have otherwise gone to the emergency room when they could just go to the mobile outreach clinic. So we're starting to look at some of those things and really measure that impact, that return on investment.
That's fantastic. So that means you're going to need more volunteers, I assume, to help you with all these different services and programs. You're probably going to need more staff as well to hire.
Yes, absolutely.
So there's a cost to the future, right?
Of course. There's always a cost.
So then you're also going to need more funding to be able to pay for that staff. Yeah. Well, I think it's fantastic. We do just have a couple minutes left. I also just want to touch upon the fact that Care Connect, as you mentioned before, it does play a role in helping end homelessness in St. Johns County. So just talk a little bit about that before we run out of time.
Yeah, we're the lead agency, like I had mentioned. We know that housing is healthcare. We know that those things are tied together. If you don't have housing and you have any kind of health issue, we know that, you're not going to be getting the services that you need, and you can't manage in the way that someone who is stable in a home can manage. We know this. And so it's critical for the hospital to lead these conversations. So every month we have a board meeting with a continuum of care, as well as the general membership meeting. And that is really where we talk about what funding we've received from the state, from HUD and DCF, as well as determine what's lacking, what are the gaps. Each year we have a point-in-time count that the lead agency conducts with the help of collaborative agencies in the community, looking at what is our count of individuals experiencing homelessness in St. Johns County. That gives us a really good pin to compare year after year to look at, is it our senior population that's rising? The answer is yes. Homelessness in seniors is rising, and so we need to put some funding structure and programming around that. So we're really assessing these things on a regular basis and then deploying these various programs. So the COC is a critical piece of St. Johns County, and we're great to have, we're so grateful to have such a collaborative board and general membership. We have many providers coming around the table for that conversation.
Yeah, and I just want to give a shout out to the providers. I attend the meetings monthly, and then I have volunteered on one of the committees that does the scoring for the applications that come in. And so, so I had the privilege to kind of read through the applications and to learn more about these providers and what they do. And it's just amazing, the work that they do, and the fact that they just they're so passionate about it. Like they really truly are passionate about helping people get out of homelessness, and so it must be rewarding for you and your staff to be able to be a part of that and see the providers do their work and hear the success stories.
Yeah, absolutely. The providers, like I said, everything we do at Care Connect, we wouldn't be doing without the collaboration of our community agencies. They are the heart of this community. We just seek to bring them together around the table. So they're doing some really incredible work in, ending homelessness for individuals, providing services to prevent someone from becoming homeless, focusing on our youth, our seniors, those veterans, those kinds of populations. And so I would encourage anybody who's interested to please go to the St. Johns County COC website. We have a separate website just for that, for you to learn about opportunities to get engaged, if there's events coming up, general membership. If you'd like to learn more about the funding that is deployed in St. Johns County, it is all public information. So I always urge people to go learn about that, and please come to a general membership meeting. The more resources we can have around the table, the better. It doesn't just have to be a housing resource, because we know that we have to collaborate holistically to provide good services.
All right. Well, that music means it's time for our show to end. Thank you so much for being here, Paige.
Thank you so much.
And next week, we'll have Paulette Kozlowski, manager of our COA Sunshine Center and Community Caregiving Program, in the studio, along with one of the caregivers that she serves. So tune in next week, same time, same place, right here on WFOY 102.1 FM.